Hello, my name is Lily and I'm a third year student nurse from Newcastle, and today I'm going to be talking to you about how to become a community nurse. I'm currently on my final management nursing placement and I'm due to qualify this summer. I've recently been offered my first ever newly qualified nurse position, and it's as a community nurse, and I'm really excited about it. I knew that I wanted to be a community nurse from the very beginning of my nursing journey, just as I applied to university in 2019. I wanted to be a community nurse because I was really inspired by two nurses that provided end-of-life care to my nana in her own home. The nurses that looked after my nana were so kind and competent and really listened to the needs of my nana and my family. This is the kind of care that I like to provide for my patients in the community now. Throughout my student nurse journey, I've been allocated a lot of different kind of specialities within nursing. So I've had day surgery, oncology, general medicine, trauma orthopedics and community. And although there was a lot of different skills that could be gained in these different specialities, I always had my heart set on community nursing. Throughout this video, I'm going to show a bit of an insight into how to become a community nurse and the kind of roles and responsibilities that are expected as a community nurse. What sort of qualifications or experience do you need to become a community nurse? There are a range of ways you can actually become a community nurse. Firstly, I'll talk a little bit about my own journey and then I'll discuss some other routes you can take to become a community nurse. So personally, when I applied to study nursing in 2019, I didn't have any healthcare or nursing experience. I had quite a different previous career. After finishing my A-levels, I began working in kitchens as a pastry chef. I worked in a range of bakeries and patisseries with the ambition of opening my own chocolate business in the future. So I used to spend my day making creams, chocolates and pastries, and after gaining a few years experience in these bakeries and chocolatiers, I finally opened my own chocolate business. But unfortunately I decided that being a small business owner wasn't really for me. I found it really difficult to make any money due to the cost of ingredients, and I really struggled with a work-life balance. So I decided to retrain as a nurse after caring for my nana at home. So I personally decided to take the university route into nursing. You need to have a combination of level 3 qualifications such as A-levels, T-levels, BTEC or diplomas, and Scottish and Irish Highers, or even an access to health diploma. I was lucky enough to already have 3 A-levels to meet the entry requirements for my university, which were 3 A-levels and maths and English. I have 3 A-levels in art, history and product design, so you don't necessarily need any scientific or psychology A-levels to gain access to nursing at university. However, some other universities may have different entry requirements. But don't worry if you don't have A-levels, because you can do an access to nursing course at college, which usually lasts 1 year. So I didn't have any healthcare experience prior to starting my nursing degree, but I did have a lot of transferable skills, such as being good with time management, good communication and being a good listener. But a lot of my nursing friends at university had lots of healthcare experience prior to starting their nursing. Some of them were healthcare assistants or healthcare apprentices. Others had even worked in care homes and dentists before. But don't worry if you don't have a lot of hands-on experience, it doesn't hold you back. You can also become a community nurse via a different route, such as becoming a trainee nurse associate. This is where you gain on-the-job experience and attend theory sessions, but you also do receive a wage unlike a student nurse. So once you qualify as a nursing associate, some choose to do a top-up course where they can carry out more theory and research, and then they can become a band 5 registered nurse. The starting salary for a band 5 community nurse is about £27,000 a year. After about 2 years, you will progress onto about £29,000 a year, and the final pay progression of a band 5 after 2 more years is around £32,000 a year. In order to progress on a band 6 nurse in the community, You'll have to undertake a more management position, which sometimes requires an extra year of postgraduate study at university. A Band 6 community nurse can earn between £33,000 to £40,000 a year. So what are the duties of a community nurse? The duties of a community nurse are very varied. They tend to work between patients' homes, clinics and care homes, so every day is different. Some days visits will be focused on monitoring blood pressure or blood sampling, or you may have a clinic day where you undertake a lot of catheter care or wound dressings. Community nurses can also administer medications such as injections, blood glucose monitoring and intravenous drips. They also have a really important role in providing end-of-life care and bereavement support to families at home. Therefore, they provide holistic and tailored care to those nearing the end of their life. So what sort of personal qualities do you need to become a community nurse? As community nurses visit people in their own homes, they need to be able to build a rapport quickly with individuals. This ensures that the relationship between the patient and the practitioner is built upon dignity and trust. You have to be able to empathise and connect with people, as you may be meeting some of the most vulnerable or marginalised in society. Alongside this, community nurses are lone workers, therefore they manage their own workload. You must have really good time management skills and be able to work logically to ensure that you finish work in a reasonable time. You also must have critical thinking skills, as you're a lone worker. Therefore, you must have a strong evidence base to ensure you can make decisions to escalate care appropriately. Alongside good time management skills and communication skills, community nurses also have to be quite practical. They undertake some invasive procedures such as obtaining a blood sample or inserting a catheter, so you have to be quite dexterous. There are a lot of different career opportunities for a community nurse. Some choose to go into school nursing, others into health visiting, frailty, neurology, specialist MS nurses, hospice nursing, there's community oncology nurses, sexual health nurses, or even specialising in tissue viability. Within the NHS long-term plan, it states that more focus and funding will be given to community nursing. This is because community nurses can really help reduce the burden on A&E by helping people live well at home. So how do you deal with the emotions of the role? Community nurses have an important job in providing end-of-life care at home, so naturally this can be quite emotive or upsetting. Sometimes you may wonder if you got it right or whether you could have done a better job. This is why it's important to reflect upon the experiences you have as a nurse, as it enables you to not only learn but also process your own thoughts and feelings. By being self-aware and in touch with your own emotions, this can help reduce the chance of burnout. Burnout is due to ongoing chronic stress and can lead to feelings of hopelessness and disengagement. However, this can be avoided by being self-aware and making sure to self-care and talk to others about how you feel. So, finding a job as a community nurse. I managed to get my own community nurse role through a pool interview which the University and Hospital Trust organised. So this pool interview was available for all third year nursing students. And within a pool interview, you kind of choose which area or specialty you want to work as a newly qualified nurse. So I personally chose community nursing on mine, but there's a lot of different options available. A lot of my friends chose A&E or surgery. Some of them chose intensive care. So within the interview, they ask you questions and you scored on how well you answer them. And depending on how well you answer the question, do you get your first, second or third choice. You can also take a look at the NHS job website where you can input what sort of role you're interested in and the location near you. So to conclude, the role of the community nurse is so varied and really important. Community nurses look after some of the most vulnerable and marginalised in society, so community nurses must have appropriate skills to ensure that they meet the needs of these people appropriately. I find the job as a community nurse extremely rewarding. I really enjoy supporting those live well in their own home and creating a strong therapeutic relationship. A lot like other nursing roles, the role of the community nurse can come with long hours and increased workloads. But I personally wouldn't want to work anywhere else. However, more funding and appropriate staffing levels are needed to enable community nurses meet the needs of patients at home. This funding and more appropriate staffing levels could help reduce the burden on hospitals by reducing the demand for hospital beds. It should also increase the quality care given to those in the community. I really hope you enjoyed my video on how to become a community nurse, and I hope it provided a bit of an insight into the sort of roles and responsibilities expected of a community nurse. Thank you for watching.